I'm curious. I am curious. Curious.
By nature.
Welcome to Curious by Nature. I'm Jessica Johnson, the CEO at Newswise. Joint replacement technology has advanced significantly in recent years, with better materials and more precise surgical techniques, leading to the number of these procedures more than doubling in the past decade. But there are limitations to what patients can do after a knee or hip replacement. Many of them struggle to regain the full range of motion and stability of their younger joints, requiring extensive follow-ups and physical therapy. This week's guest from Mercy Medical Center in Baltimore is using innovations like robotic surgery and implanted sensors to give patients their best chance at success with their joint replacement. Dr. Hungerford, welcome. Please introduce yourself.
Yes, my name is Marc Hungerford. I'm the director of the Joint Journey program, and I'm also the chief of the Division of Orthopaedics here at Mercy Medical Center in Baltimore, Maryland.
Can you tell me more about what you do and, I guess, specifically a new technology that you're implementing?
So I'm an orthopedic surgeon. I'm subspecialized in hip and knee replacement. We're always looking at new technology, and we incorporate new technology every year. Some of the biggest steps that we've been involved with have been anterior approach, minimally invasive hip replacement, and robotics for partial knee replacement and total knee replacement. We've been involved in those efforts. Hip replacement now for almost 20 years, and knee replacement something like 15 with the surgical robot.
I'm particularly interested in the knee replacements because both my parents have recently, within the last year and a half, have had knee replacements and maybe going to the second knee. And they have both had a partial knee replacement. And when I heard about this new technology that maybe you can tell us more about, I was curious if this is applicable also to the partial knee replacement?
Yes, it's very, very well suited to partial knee replacement. The difference between a partial knee replacement and a full knee replacement is when you do a partial knee replacement, you're only operating on one half of the knee, either the inside half or the outside half, and therefore the parts that you're implanting are much smaller, and therefore it's more difficult to make accurate cuts in the bone to place them exactly. And that's where the robot gives you an advantage, is in the accuracy of implant placement.
So tell me more about the robot and the new technology that is added to the knee.
Right. So robotics is a broad category, and it means different things in different medical specialties. For example, the Da Vinci robot that they use in general and obstetric gynecologic surgery is basically a surgeon-directed robotic arm that reduces the magnitude of the surgeon's hand movements and makes them very fine. And so that is a completely different robot than what we're using in orthopedics. Our robot is what's called a haptic arm, and the surgeon guides the robotic arm. So I'm actually holding the robotic arm, and it's giving me feedback. It's basically stopping if I go where I'm not supposed to go. So for this type of robot, for this haptic robot to work, you have to get a CAT scan of the patient's limb, so their knee or their hip, and then you have to register the patient's limb into the robotic software so the robot can know exactly where the patient's limb is in three-dimensional space at all times. Then you bring the robotic tool in and you use that to make precise cuts in the patient's bone. And it doesn't matter if you move the knee around while you're making those cuts, because the haptic robotic arm will adjust its position to the new position of the limb. So, that's the way this particular orthopedic robot works.
How long have you been using that robot?
So we were, I think, nationwide robot number 13 or 14, and we've been using it since, I'm going to say, I'd have to ask the marketing department, but I think it was 2012 when we got it. So 12 years, something like that. So it's been a good long time. Yeah.
But now you have also another technology, an implant that you're using.
There's a sensor technology And it's basically the same technology that they use for pacemakers. It has a little tiny battery on it that only turns on for, a couple minutes a day. So it can last 20, 30 years when implanted into the body. And we have this piece of technology that's attached to a standard orthopedic implant. And what it does is it can give us a step count and a range of motion that the patient is putting on their knee, and also the angles that they're flexing during their gait and during their daily activities. And we can then get a readout of all that data, and we can monitor it and we can compare it to other patients. So currently, it'll allow us to see how quickly the patient is rehabilitating, and in the future, we'll have all this data where we'll be able to see, certain types of problems or how different types of implants react either better or worse than other types of implants based on this sensor data.
What would that impact? What would that data impact, or what have you seen it impact currently with some patients?
Well, say, for example, you have a patient that basically isn't walking much.
Hmm.
In general, in orthopedic practice, you would see the patient back at 2 weeks and then you'd see him at 6 weeks.
Hmm.
In this case, we can see at 1 week, this patient just isn't moving and they're just not, bending their knee enough. And we can call them up and say, what's going on? Are you having pain, or are you just not working hard enough in physical therapy? So we can get ahead of some problems that can occur during the rehabilitative phase instead of waiting till we see that patient in the office.
What about further down the line? Is there anything else like wear and tear or something on that particular knee, or is there other information that the sensor gives you?
So the way this worked in cardiology is kind of parallel to how I think it's going to work in orthopedics.
Mhm.
The way it worked in cardiology is you had these pacemakers and you had patients with hearts that were doing different things. Like some people were having problems with their valves, some people were having problems with their rhythm, some people were having problems with the circulation, heart attacks, etc. And all of these things gave different patterns with the pacemaker, and those patterns were transmitted via the sensor. And once you get enough of them, you start to be able to connect the pattern that you see with the problem that the patient is having. And I think we're going to see similar things with these knee replacement sensors. What we're going to see is we're going to see problems like infection, instability, ligament imbalance, failure to achieve full extension, failure to flex past 90. And also there's different implant designs, which ones are better in which situations for which people. In order to do that, you need a lot of data and you need to be able to correlate what you do in the operating room to what outcome the patient is functionally actually having. So if I see a patient post-op and I say, "How's it going, Mr. Jones?" And he says, "Fine." And I say, "Can you get up and down stairs?" And he says, "Yes." And I say, "Do you need a handrail to get up and down stairs?" And he says, "Not to go up, but to go down." Well, that's good data, but it's very, very primitive. If I can then take that information and I can look on his walking trace from this sensor, and I could say, okay, well, the reason that this patient has to use a handrail going down is because the knee is slightly unstable when he's going down. Or I can say, well, he's not bending the knee enough. Or I can say it's because his thigh muscle's a little weak. So it really helps develop a lot finer detail in what the patient's issues are and how to address them. That's what we're hoping for in the future. That's what makes it interesting technology.
Or what's the future in your field?
Well, so joint replacement is incremental because it's already very successful.
Mhm.
So there's not big radical changes, because if you make a big radical change with something that's already good, you're more likely to make it worse than you are to make it better.
Mhm.
And going back to tires, why are tires all made out of rubber? Why are they all inflated with air? Because that works and it's worked for 100 years. So you're not going to make a radical jump because you're more likely to be worse than better. However, there still is plenty of room for improvement. There's room for improvement in materials. Right now, all the materials are hard. Maybe we can come up with a material that's a little bit flexible, a little bit more like cartilage. There's a lot of room for improvement in cartilage technology. Are there ways to prevent patients' knees and hips from deteriorating where you don't have to replace them in the first place? There's a lot of room in that field. And then with implants, we could get better pain control, less invasive surgery, more athletic outcomes, more people that can run and do those sorts of things with artificial joints. So there's certainly room for improvement.
Actually, that's particularly something I wanted to ask you about is with knee replacements, partial or full, running afterwards. Is that not possible?
It is possible. It's not recommended in terms of wear of the implant. And for a lot of people, while they're allowed to do it, they're not able to do it. So, that's a big difference to say, is it going to hurt the implant? No. But is it going to give you a lot of pain? Quite possibly. The more involved the surgery is, the more impact that's going to have on the patient. So if you do a partial knee replacement, you're operating on less of the patient's knee. So they have a more normal knee, and they're going to be more likely to be able to do higher levels of activity than with a total knee replacement.
So if there's someone who is 80 years old and they want to be able to run afterwards, it probably won't be affecting the wear of the implant, but it might not be comfortable for them. Is that what you're saying?
So somebody who's 80 years old and wants to run with their total knee, usually those people need to have their heads examined. It's the 50-year-olds that want to run where you have to have the discussion, and then the issue becomes like, let's say somebody can do everything they want to do except run. Okay. And they can't run because they have an arthritic knee and they want their knee replacement so they can run. Well, then the question is, what's the likelihood of them being able to do that? And what's the likelihood of them not only not being able to run, but also, being a little bit worse than they are now, like they have some stiffness or some aching in the morning or some aching at night. A knee replacement is not a 20-year-old knee. It's not a 20-year-old knee. It's an artificial knee.
Mhm.
Just like an artificial heart's an artificial heart. It's not a 20-year-old heart. So I think, we're kind of victims of our own success to some extent because the operations have become so successful and so popular that there's this conception that I'll just get my knee replaced and I'll be able to do whatever I want. That's unfortunately not always true.
Is there any question that I haven't asked you that you would like to answer or talk about?
Well, I mean, one of the best things about my field is that people get better, and so I think it'll continue to improve incrementally, and we'll be able to help people get back to improved quality of life, and that's a great thing to be able to do for people.
Yeah. What about for the media? Is there anything in general that you would say you would like the media to understand more about your field or specific research or something else that to share with the general public more?
Um, I would say, so a lot of times when you're talking about technology in medicine, we're a very commercially oriented consumer culture, and that's good in a lot of ways. Informed patient's good patient. However, picking what's best for you shouldn't just come from a Google search and YouTube videos. You should really find somebody who's an expert in their field and who's done it for a long time and who gets good outcomes and listen to whoever that person is. Because this is what they do. Like you wouldn't call a plumber and then tell them what wrenches to use and what kind of glue to use. So I think people do sometimes make a mistake where they become enamored of a certain technology and then they find the doctor that they want to have do it and they go into the office and say, yeah, hey, Dr. So and so, I want you to do this.
Mm.
And if the doctor acquiesces, I think the reason that the patients are doing themselves a disservice is I'm good at doing what I do. Okay. I'm not necessarily good at doing what the other guy does.
Mhm.
Do what I do. So if I have a patient who comes in saying, "Hey, Dr. Hungerford, I really want you to do this for me, but I want you to do it in a way that you've never done it before," and they expect it's going to turn out as well as what I do each and every day, chances are it's not going to.
Mhm.
So it's not just about the technology and testimonials online, but it's also about the experience of the doctor doing the work.
Mhm.
And find somebody good and let them do what they do. And that's your best chance of having a good outcome.
What made you decide to go into orthopedics and maybe specifically knees and hips?
Well, my father was an orthopedic surgeon and he specialized in knees and hips. So that kind of made the path easier. I like to work with my hands. I like to mess with mechanical things, motorcycles, cars, carpentry, things like that. And this is basically carpentry on bones. So
Mhm.
we have the coolest tools. We have stainless steel saws and robots and big hammers, and it's a lot of fun.
Okay. Wonderful. Thank you so much for taking the time.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.